Welcome to This Week in Health IT with our continuing series on coronavirus prep. We've moved from understanding the health IT problems that the health systems are facing to looking at a set of solutions. My name is Bill Russell, Healthcare CIO Coach, creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. Before we get going, I want to give you 3 resources for those in health IT during the crisis. For CIOs, I'm currently helping my coaching clients walk through this as a sounding board and advisor through this time. If you'd like to connect with me over the next 2 months to experience coaching at no cost, shoot me a note at bill@healthlyrics.com, or you can hit the website healthlyrics.com. For anyone in health IT, 2 more resources. For anyone in health IT who finds themselves in uncharted territory and you want to crowdsource solutions with a team of seasoned professionals as well as other health systems, we've set up 2 ways to do that. We now have a Slack channel that is monitored and supported by our sponsors, who I am greatly appreciative of how they've stepped up: VMware, Galen Healthcare, Sirius Healthcare, Starbridge Advisors, and Pro Talent Advisors, as well as Health Lyrics. I'm monitoring the channel as well. The Slack channel allows you to get your questions answered. Things like, can my telehealth scale? We're having problems with VDI. What's the best telehealth solution? What's a good backup telehealth solution? Which ones are you using for clinical versus business? You name it. That channel is designed for you. We launched that on Tuesday, yesterday, and we have gotten all the technical resources on it, and the channel, the glitches worked out, so we are good to go. If you want access to that, send a note to slack@thisweekinhealthit.com, and we will get you set up immediately. You're going to have to use your health system email address in order to do that. That's the only way we can verify that you're with a health system. We want to protect the integrity of the channel. Our sponsors are also supporting an email channel at support@thisweekinhealthit.com, and you can tell we're moving a little fast here, but it's support@thisweekinhealthit.com. If you just want to shoot an email over, get it routed to an expert in your area from our group of sponsors, we will do that for you as well. Again, I want to thank each of our sponsors for stepping up to provide these services to our listeners and the industry. Now we're going on to actually one of the first of a series of interviews I'm going to be doing with technologists around what they are finding as they work with their clients and what solutions they are finding that are working. Today, I'm talking to 2 people from Sirius Healthcare. I'm talking to Josh Peacock, who is the health solutions architect for Sirius, as well as Kyle Quinby. And the 2 of them have been working on solutions to scale VDI and to scale the clinical settings within health systems, and they have written some really good material, and I'm looking forward to sharing that with you. All right, we're joined today with Josh Peacock, the health solution architect for Sirius, and Kyle Quinby, a infrastructure solutions architect as well. And I'm really excited about this conversation. We've transitioned the conversation from really understanding the problem set. So we've talked to a lot of CIOs, and they're saying things like, scale my VDI environment. How do I ramp up people working from all over the place? Telehealth, obviously people are ramping that up and whatnot. And what I wanted to do was talk to people who are solving some of these problems and get really pragmatic and into the weeds. And you 2, they locked the 2 of you in a room and said, figure these things out. And I love the fact that they gave me access to the 2 of you. What are the kind of things, Josh, we'll start with you. So what are the kind of things that you're working on in the lab right now for your clients?
Well, some of it, we really took what we learned, even what we talked about in the last podcast I was on with you around cloud connectivity and using the cloud as a way to use DR. We took that, modified it a little bit, and offering that up as a way to expand and burst certain components of the environment up into the cloud in a pretty short time frame. And then the other one, which Kyle can talk about, he's been dealing with a lot, is really the remote workforce and how do we help enable that group to do stuff securely and effectively from home.
Awesome. All right, so let's break this down. We'll start with VDI. So we just sent a whole bunch of people home. Actually, we sent most of the workers home that we possibly could. I'm hearing people say, scaling this stuff up in order of magnitude, which is just up until this point unheard of. We would have never done a project this quickly. So, Kyle, what are some of the considerations as people are ramping up this VDI environment, sending people home, getting them situated? What are the kind of problems that you guys are looking at and trying to solve?
Sure. So a couple. Number one is while we are looking at capacity, security is a huge concern, right? I'm going home on the family PC that my kids have downloaded who knows what to, and how to make sure that I can, use that to get into an environment and keep things secure. So we've been looking, to leverage a lot of the existing VDI solutions and vendors that we know and love. We see a lot of customers trying to leverage VPN, which honestly can be a little bit risky, right? To just connect that home PC up to the corporate network. So we're really looking at these VDI solutions that can allow those kind of endpoints, those unsecured endpoints, to get in securely. And at the same time, it's really got to be easy for the end users. It cannot be a lot of steps, because at this point we just don't have the time to give everybody the white glove treatment, right? We got to be able to get people in really fast. For example, I just got off with a customer right before this talk that normally had a high water mark of about 450 users, and yesterday had 4,500 users on their system.
Wow!
So that kind of ramping, you've got to be able to scale it really, really quickly, and it's got to be dead simple to get in place.
Yeah. So, oh my gosh, I have like 1,000 questions now. So we'll try to make this a shorter podcast. But, my first question is, so you're connecting up a VPN, which would be the first thing that somebody would think, oh, well, we'll just connect up the VPN. The problem is you have no idea where that computer has been. So you just can't connect it up. So you want to create an abstraction layer, and this abstraction layer is delivering that VDI workstation down. Are you simplifying the application mix of what you're actually delivering down, or are you trying to deliver a core desktop that has been sort of pre-thought out prior to this?
Well, I mean, this is something Josh and I have been working with, and I think right now we're looking at the minimum amount of applications to get the job done, right? The less applications we have in the mix, the easier the challenge is. So a lot of what we've been focusing on is kind of the core EMR apps that are needed to work effectively. So at the end of the day, we're just trying to support the folks that are on the front lines trying to take care of this.
So the problem with VDI is, the challenge with VDI is, you go from these workstations running all the applications, which is really simple when you think about it. Everybody goes home and works on their own workstation. But essentially what you're doing is running the workstation in the data center, as all of our listeners would understand. How are you ramping up the equipment? Because most organizations weren't scaled up for 4,500 workstations prior to this. They were scaled to whatever their run rate was, which was plus or minus 20%. So they were probably scaled to 600 workstations. Now all of a sudden they're at 4,500. How do they burst that up? How do they ramp that up so quickly in the data center?
Yeah, so we're airdropping servers. We can't do that. So some hospitals or some locations have additional capacity in their DR. In some cases they're required to by standards, and in some cases they're able to flex, right? Where let's take advantage of our DR capacity. And in some cases that's enough to meet the demand. In some cases it's not, or they don't have that capacity in DR. So at this point, a lot of hospitals are asking all of their workers to come in, right? They're just absolutely swamped. So that's where the cloud comes in, public cloud, both Azure and AWS. We're able to sort of take advantage of, that's the whole thing about public cloud, right? Is to be able to flex and expand your capacity on demand. So this is almost like textbook how cloud suits the problem. So in a lot of cases, what we're doing is we're hooking up via VPN tunnel or existing connectivity options if they already have a presence in public cloud, and connecting virtual networks where we can spin these desktops up in the cloud and be able to traverse back to on-prem securely. And again, securely, we want to make sure we're not just opening things up or exposing, records. We're trying to do this as securely as possible.
One of the things I like is you guys sent me over some documents prior to this, and Josh, eventually I'm going to ask you for where people can find these documents. So you're going to want to have the URL handy. But I'm looking at these documents, and you made it so simple that a CIO could understand them. And it's almost like a run book or a recipe book for this is how you do it. This is how you're going to scale out. This is how you're going to scale up in the cloud. And that's the kind of stuff we need in a crisis. You don't need, these, just really challenging, difficult things to scale up. All right. Hey, so is there anything else, Kyle, is there anything I forgot to ask you? Because again, I'm a CIO. I'm not as technical as you, that you guys are focused in on that I should be, that I should have asked that I'm missing?
I don't think so. I think, you nailed it. There's ease of use, security, and making sure that we're focused on the base apps that are needed to get the job done. And that's the way to get it done as quickly as humanly possible.
So I'm sitting here on my Mac. You're going to be able to let me run things on my Mac in this environment?
Yeah, Mac, Windows, Linux. There's pretty much endpoints or software for any number of endpoint devices. Because
when you send that many people home, you really don't have control over, what's going to be used. Josh, let's talk about scaling up these core applications. Obviously, the most pressing one is the EHR. And I imagine a whole bunch of use cases just materialized overnight that people had not anticipated. Potentially, number of users grew. Potentially, the workload on those systems grew. Is that what you're finding? Is that what you're hearing from your clients? What kind of challenges are they facing?
Definitely an exploration to make sure that they understand what their options are. One of the things we've seen is actually because of people staying home, canceling of electives, and other things like that, it's actually reduced the amount of consumption of some of our clients' environments. But we're also expecting as some of these really hard hit areas have to ramp up and increase bed counts, and maybe we're hearing that they're going to be looking to bring back retired clinicians and other people from private practice and such. We do expect that there might be an increase. And so what we were trying to do is just provide some options so that if they get into a situation for whatever reason, they don't have, the opportunity to expand internally and they need that extra capacity, that we can provide something from a, delivery of the EHR core application. So
if you came into my environment, let's just take assume I'm an Epic shop, I'm ramped up, and all of a sudden my utilization started to peak or go over. Is that the kind of thing we're talking about at this point?
Yeah, we'd obviously like to have a little bit of ramp time to help you alongside that as you're seeing. But some of the things that even ahead of time that you could be looking into to request, for example, ISPs. If you don't already have express routes or direct connects or whatever to your preferred cloud vendors that are close, asking your ISPs if there's a way that they can quickly turn up and give you more bandwidth to be able to take care of the need down the road. That provides some quick steps to help us start prepare for it, and then the team can come in and help address building out that environment in the cloud to scale up into and burst into.
So again, if I'm an Epic shop, most of my stuff is on-prem. I mean, I know there's a bunch of hosted, but there's a lot of on-prem. Kyle talked about utilizing DR capabilities. Is that what you guys are? You're sort of tapping into that kind of stuff in this?
Yeah. So part of what we would also see too. So our team, like Kyle, is super busy helping organizations inside and outside of the healthcare industry right now. But so the healthcare team has really been taking it to focus on kind of addressing the situation initially to see what we can help out with. One of those would be, if there's an organization they're already active, they likely have 200% of capability between sites. If they're active passive for Citrix in their environment, we can maybe help them spin up if there's not too much latency between. So there's a lot of things that we can help address before we even have to get to cloud. But the cloud does offer up as an option at the end if we can't utilize stuff they have on the ground. And maybe even that's, Kyle and I have been talking about how do we segment users so that maybe more business-focused users have the more degraded performance environment. If you're too far away or a lot of latency, they can use that because they can handle that extra degradation in performance, and then focus the clinical teams to have the stuff that's on-prem and most valuable performance.
So we're talking about the EHR. What other systems are you guys looking at? What other clinical systems are you looking at that may see increased capacity as we sort of step into this?
So we've been looking at a lot of Mostly the business side apps have been potentially like VDI options, and some of that's new exploration for organizations because they haven't had true VDI in the past. But most of it has been focused currently on EHRs just because that is what we have. It's the easiest and most known quantity that we can expand up into the cloud at this point in time.
Yeah, you know what's crazy? I remember, so we were doing VDI and we stood up our first, and we chose a small location. We stood it up. And we learned a lot of things, virtualizing those applications, packaging them up, that whole thing, I think took about 3.5, 4 months to really get that desktop solid. And then we started to work on scaling it. And I would say it took us a good 6 months or so to scale it effectively. We a lot of things about latency, a lot of things about bandwidth and latency essentially, but as we were sort of progressing, we're doing that very rapidly now. Are there, how long does it take from the point that a client calls you and says, look, we need to scale up our EHR, we need to scale up our VDI, and we'll keep those two separate. How long does it take for them to get from where they're at to where they're going? Assuming, they probably have some equipment they can scale to, they probably have some DR they can scale to, but they may even need to go to a third tier, which is, offsite and those kind of things. So let's just start the question there, which is how long does this usually take?
Well, I want to add one point quick too, is that we've been focused in on leveraging technology they already have in place because we don't want to put any extra load on the help desks or the teams that are trying to support the stuff too. So we're leveraging technology they already have in place as much as possible in the conversations. As far as deployment and those pieces, I'll actually let Kyle speak to those.
Yeah, so this is basically what we put together in the documentation that you were taking a look at is all about speed, all right, because we don't have time to waste here. So it is leveraging existing systems. So just to use Citrix as an example, we're treating like Azure or AWS as another resource location. So most of the work is taking the image that they already have that's been vetted. So you talked about, taking several months to get an image really solid to where you liked it and you could roll it out to your users. We're not trying to reinvent the wheel there. In a lot of cases, we can take the image that they already have on-prem and prep it for Azure or AWS. There's a documented process on how to get that ready. And then we can put it out there and essentially spin up just like a stamp out, a whole bunch more hosts and a whole bunch more resources using that image. So in that sense, it's already pre-vetted, it's already pre-baked. We're just extending what they already had and eventually cloud bursting, right? Taking what they have and just giving them a lot more room because they can't get additional servers, shipped in. So we're giving them the compute cycles, we're giving them the memory cycles, we're giving them the disk, and we're taking their image and just running it up there and just making sure we can backhaul that traffic over the network link. So it's actually something where it's very short runway to go from, oh my gosh, I need help, to, okay, we got our resources up and running, we've got additional users, and we've got additional capacity in the system.
I love that. This is the scene from Apollo 13, isn't it? They locked you in a room, they dumped all the stuff down and said, okay, we're not going to spin up new this, we're not going to spin up new this. With the equipment that's on site, as quickly as possible, how do we go from 450 users to 4,500 users? And that's the challenge. Josh, where do they go to find these resources?
Yeah, we'll be posting, so Sirius has a site that we're supporting across the industry, but we'll have an area that's specific to healthcare around COVID-19. So we'll have that out and available. We'll get a link to you, Bill, to post along with it.
All right, and I will download those and put them up on the This Week in Health IT website. We'll put it under the COVID-19 resources. You guys can get those things, and then if they want to contact you guys, they can do that as well. What's the best way to get in touch with you guys, or is there a better way to get in touch with you than just going direct? I would assume there is.
I'll take a direct call. Anybody on the healthcare team, also, I know your Slack channel that's opening up, we'll have that a couple of us staffed on that to help out answering questions too.
Yeah, I appreciate that. So you guys are manning the Slack channel as well, and so if you guys want access to these guys to hit them with a couple of questions and get some support. That's another way to do that. Guys, thanks for taking the time. I know you're busy, and I appreciate the work that you're doing for the industry right now. And I look forward. Are you in the process of thinking through another white paper that you're going to be writing?
We do have a few other ones that are in flight being written up about different aspects. A lot of it about how we support different access methods, as maybe we expand some of the testing and remote clinic capabilities as well too.
Yeah, and I don't want to give people the wrong impression. White paper, it was the thing I loved about it wasn't the normal white paper jargon. It was really right to the point, step by step. Here's how you get from point A to point B. And I really appreciate you guys taking the time. Thanks. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, you can check out our website, thisweekhealth.com, or the YouTube channel. If you want to support the show, best way to do that, share it with a peer. However you do that, send them an email, send them a whatever, DM, whatever you do, that's what you should do. We'll be back again with more shows as this progresses. We'll try to drop one a day until we flatten the curve. Thanks for listening. That's all for now.